Smart Healthcare for Aging, 5 Tests to Reconsider After Age 70. Have you ever wondered, is getting regular health checkups really the best way to protect my body as I age? Most of us have been taught that routine checkups are a must, a way to prevent rather than cure. But what if I told you that, at a certain age, some medical tests may not only be unnecessary but could also lead to serious consequences? It sounds surprising, but this is a truth that leading doctors in the US are increasingly acknowledging, especially when it comes to healthcare for those over 70. This article isn't just a dry medical lecture. It's a journey to help you discover how to protect your health wisely, steer clear of unnecessary medical traps, and live a healthy, peaceful older age. We'll dive into 5 common but potentially risky tests for older adults, explaining why they're often recommended, the risks they carry, and, most importantly, how you can make smarter decisions for yourself or your loved ones. If you or someone you care about is 65 or older, or if you're caring for parents or grandparents, this information could change the way you view healthcare. Let's get started, because healthy aging isn't about doing everything possible, it's about doing what's truly necessary. Why does healthcare for older adults need a different approach? The body at 70 isn't the same as at 50. When you reach 70, your body undergoes natural changes that no one can avoid. Your immune system weakens, recovery slows, and organs like the heart, kidneys, and liver function less efficiently than in your youth. This doesn't mean you're sick, it simply means your body is adapting to a new phase of life. However, modern healthcare systems, especially in the US, often apply testing and treatment protocols designed for younger or middle-aged people. These protocols aren't always suitable for older adults. For example, a test that's safe and beneficial for a 40-year-old could pose significant risks for a 75-year-old. This is why we need a personalized, less invasive approach that prioritizes quality of life over the quantity of tests. The more testing, better health culture in the US. In the US, healthcare culture is often driven by the mindset of the more, the better. Hospitals, private clinics, and even insurance companies frequently promote comprehensive health screening packages that include tests like colonoscopies, CT scans, or cardiac stress tests. However, studies from reputable organizations like the American Medical Association, AMA, and the Centers for Disease Control and Prevention, CDC, show that, for older adults, overusing tests can lead to serious consequences, from medical complications to psychological stress. 5 tests to carefully consider after age 70. 1. Colonoscopy, gold standard or hidden trap. Colonoscopy has long been considered the gold standard for detecting and preventing colorectal cancer, one of the most common cancers in the US, with over 150,000 new cases diagnosed annually, according to the National Cancer Institute. However, after age 70, especially if you have no symptoms, such as abdominal pain, blood in stool, or unexplained weight loss, or family history, routine colonoscopies may pose more risks than benefits. Risks of colonoscopy in older adults. Preparation for the procedure. Before a colonoscopy, you must take strong laxatives to clear your bowels. For older adults, this process can cause severe dehydration, electrolyte imbalances, low blood pressure, or even falls leading to fractures, a serious issue, as hip fractures in those over 70 account for 300,000 cases annually in the US, CDC. Sedation or anesthesia. Older adults metabolize sedatives more slowly, increasing the risk of confusion, disorientation, or cognitive decline after anesthesia, post-anesthesia cognitive dysfunction. A study in the New England Journal of Medicine found that 10 to 15% of people over 70 experience this condition after procedures involving anesthesia. Unnecessary findings. Colonoscopies may detect small, benign polyps that are unlikely to become cancerous in your remaining lifespan. However, standard protocols often lead to biopsies or surgical removal, which carry risks like bleeding or infection. Alternatives. Instead of a colonoscopy, older adults can consider non-invasive tests like the fecal immunochemical test, FIT, recommended by the American Cancer Society, ACS. FIT is highly sensitive for detecting colorectal cancer without the need for complex preparation or sedation. If you've had a normal colonoscopy in the past 10 years and have no symptoms, you're well within your rights to decline routine colonoscopies. Real-life story. Susan, a 78-year-old from California, was advised to undergo a routine colonoscopy despite having no symptoms. After the procedure, she suffered severe dehydration, requiring a 3-day hospital stay due to dizziness and a fall. The colonoscopy revealed a small, benign polyp, but she underwent an unnecessary biopsy. Susan's story is a reminder that prevention doesn't always mean safe. 2. Full-body CT/MRI scans, benefit or burden? Full-body CT or MRI scans are often marketed as a comprehensive way to detect issues from head to toe. In the U.S., private clinics offer these expensive scans, costing $500 to $2,000. However, for those over 70, these tests can lead to a cascade of unnecessary interventions and harm, both physically and mentally. Risks of full-body CT/MRI scans. Benign abnormalities. CT and MRI scans are highly sensitive, detecting small nodules, calcifications, or benign cysts in the lungs, liver, or kidneys, common in older adults. According to a study in the Journal of Radiology, over 50% of people over 70 have benign abnormalities on imaging, but only 1 to 2% require intervention. Complications from follow-up procedures. A small lung nodule may lead to a biopsy, risking collapsed lungs or infection. Similarly, liver or kidney biopsies can cause bleeding, especially in older adults with reduced clotting function. Radiation from CT scans. CT scans use X-rays, increasing long-term cancer risk. According to the National Institutes of Health, NIH, the radiation dose from a single full-body CT scan is equivalent to 100 to 200 chest X-rays. Psychological stress. Suspicious results can cause prolonged anxiety, significantly impacting quality of life. Alternatives. Instead of full-body CT/MRI scans, older adults should only undergo imaging tests when specific symptoms arise, e.g., persistent chest pain or unexplained weight loss. Specialists may recommend less invasive methods like ultrasound or X-rays, depending on the condition. Real-life story. James, a 72-year-old from Texas, spent $1,500 on a full-body CT scan after hearing it could detect problems early to save lives. The scan revealed a small lung nodule, leading to a biopsy and a 2-week hospital stay due to a collapsed lung. Ultimately, the nodule was benign, but James lost confidence and health due to months of worry. 3. Cardiac stress test, when prevention becomes risky. Cardiac stress tests, which assess heart function by having patients walk or run on a treadmill while monitoring an electrocardiogram, are common for evaluating heart health. However, for those over 70 with no symptoms, chest pain, shortness of breath, or dizziness, these tests can do more harm than good. Risks of cardiac stress tests. False positives. According to the American Heart Association, AHA, 15 to 20% of stress test results in older adults are false positives, incorrectly indicating heart issues. This leads to further tests like coronary angiography, stenting, or surgery. Physical risks. Older adults may struggle with the test due to weak joints, increasing the risk of falls or injuries. Excessive exertion can also cause sudden blood pressure spikes or arrhythmias. Complications from follow-up procedures. Coronary angiography uses contrast dye, which can damage kidneys, especially in those over 70, where chronic kidney disease affects about 30%, NIH. Alternatives. Instead of routine stress tests, older adults should focus on monitoring actual symptoms. If you can walk, do household chores, or engage in normal activities without chest pain, shortness of breath, or unusual fatigue, your heart is likely healthy. Regular blood pressure checks, lipid monitoring, and a healthy lifestyle, 30-minute daily walks, balanced diet, are far more effective. Real-life story. Linda, a 74-year-old from Florida, underwent a routine stress test despite having no symptoms. An abnormal result led to coronary angiography, and she suffered kidney damage from the contrast dye. After 6 months of treatment, she recovered, but her overall health declined significantly. 4. Routine colonoscopy, an unnecessary burden. As mentioned earlier, routine colonoscopies after age 70, especially for those with a clean history, often provide little benefit and can cause serious issues. Reaffirming the risks. Dehydration and electrolyte imbalance. Strong laxatives can cause heart rhythm issues or falls in older adults. Cognitive decline post-anesthesia. This can last weeks, affecting memory and daily functioning. Unnecessary interventions. Small, benign polyps often don't need treatment in those over 75, as they rarely become cancerous in their remaining lifespan. Alternatives. Non-invasive tests like FIT or stool DNA tests, e.g., Cologuard, FDA approved, are safer and highly accurate for detecting colorectal cancer. Real-life story. Robert, a 76-year-old from New York, was advised to undergo a routine colonoscopy despite no symptoms. After the procedure, he experienced confusion for 2 weeks, requiring hired caregiving. The colonoscopy showed no concerns, but the experience left him fearful of medical tests. 5. Routine cardiac tests. When the heart is over-tested. Routine cardiac tests, like coronary angiography or electrocardiograms, are often seen as a way to protect the heart. However, in those over 70 with no symptoms, these tests can cause more harm than good. Risks of routine cardiac tests. Contrast dye complications. Coronary angiography can cause kidney failure, especially in older adults with reduced kidney function. Unnecessary interventions. Stenting or heart surgery carries high risks, from bleeding to stroke, with complication rates of 5 to 10% in those over 70, AHA. Psychological stress. Abnormal results cause fear, even if the issue isn't serious. Alternatives. Instead of routine tests, focus on a healthy lifestyle, manage blood pressure, cholesterol, and engage in light physical activity. If you have no symptoms like chest pain or shortness of breath, complex tests are likely unnecessary. Real-life story. Michael, a 71-year-old from Chicago, underwent routine coronary angiography for peace of mind. The test revealed mild artery narrowing, leading to stenting. He suffered bleeding post-procedure and a 10-day hospital stay. Later, doctors confirmed the narrowing didn't require immediate intervention. How to care for your health wisely in older age. Listen to your body. Your body is your best doctor. If you're functioning normally with no unusual symptoms, that's the clearest sign of health. Don't let vague fears turn you into an unnecessary patient. Ask questions of your doctor. When a test is recommended, ask: is this test necessary for my current condition? How will an abnormal result change my treatment? What are the risks of this test? These questions help you and your doctor make decisions based on real benefits, not rote protocols. Prioritize a healthy lifestyle. Physical activity. Walking 20 to 30 minutes daily boosts heart and joint health. Diet. Eat plenty of vegetables and fruits, and limit salt and saturated fats. Mental health. Engage in social activities, meditation, or yoga to reduce stress. Healthcare in older age isn't a race with machines or tests. It's the art of balancing prevention with respect for your body. After 70, you deserve a peaceful life, free from the burden of unnecessary tests. Be selective, stay informed, and live joyfully every day. If this information is helpful, share it with loved ones, especially those navigating the maze of medical tests. And don't forget to stay updated with clear, practical health advice to live healthier and more proactively at any age.